A patient arrives at the emergency department with chest discomfort that started an hour ago. At first, the pain seems mild and the patient is still talking, but experienced nurses know that heart attacks do not always begin dramatically. Subtle signs often appear before the situation becomes critical. Welcome to the Learning Studio, where we don't just teach theory, we show how knowledge turns into real-world understanding. Acute myocardial infarction is commonly imagined as sudden collapse with severe chest pain, but many patients present differently. Some describe pressure rather than pain. Others feel short of breath, nauseous, or unusually fatigued. This case focuses on how nurses recognize an MI early and act before irreversible damage occurs. Imagine a 58-year-old patient with a history of hypertension and smoking. He reports tightness in the chest, radiating to the left arm. His skin appears pale and slightly diaphoretic. Vital signs show elevated heart rate and rising blood pressure. Oxygen saturation is slightly reduced. These findings together raise immediate concern. At the bedside, the nurse prioritizes assessment using the ABC framework. The airway is clear. Breathing is slightly labored. Circulation is the primary concern due to chest pain, tachycardia, and skin changes. Oxygen is applied, cardiac monitoring is initiated, and an ECG is obtained without delay. A myocardial infarction occurs when blood flow to part of the heart muscle is blocked, depriving tissue of oxygen. Nurses do not diagnose the MI, but they must recognize when cardiac tissue is under stress. Early intervention limits damage and improves survival. The nurse monitors pain, heart rhythm, blood pressure, and oxygenation while preparing for further interventions. IV access is established, medications are administered as ordered, and the healthcare team is updated promptly. Any delay in response increases the risk of complications such as arrhythmias or heart failure. This case highlights how nursing actions shape outcomes. Rapid recognition, calm response, and continuous monitoring are essential. Even when the patient appears stable, deterioration can occur quickly. Nursing vigilance is critical during the early stages of an MI. The nclex often presents cardiac cases by describing symptoms and vital signs rather than naming the condition. The correct answer usually reflects protecting circulation, supporting oxygen delivery, and initiating urgent evaluation. The exam rewards early action and prioritization. In real clinical practice, nurses remain alert throughout the patient's course. Changes in pain, rhythm, or blood pressure require immediate reassessment. Communication with the healthcare team ensures timely escalation and continuity of care. Now that you have seen how nurses respond to an acute myocardial infarction in a real emergency setting, the next step is understanding how different patient populations respond to illness and treatment. That contrast becomes clear when comparing pediatric and geriatric care. And that's exactly where we'll go next here at the Learning Studio.